Good afternoon, everyone, and good afternoon, chairpersons, dignitaries on the dais, out the dais, and all the delegates. Uh, Today, topic of my lecture is midlife pain map. Smell अलग है। ये बस matter में नहीं था। इसमें क्यों नहीं आ रही है? इसके बाद मैं बैठा हूँ। मुझे तो कुछ कहते नहीं है। जी सही लग रहा है। हम्म, हाँ। हम्म। Himani, can we take another lecture? I can upload the session. होगी? नहीं हो रहा है। नहीं, इसमें नहीं आ रहा है। यहाँ पे तो हाँ। शो तो नहीं हो रहा। आ गया। First of all, I want to thank Dr. Asha Jain ma'am, Dr. Jyoti ma'am, and Dr. Shalini for giving me the opportunity. We all know that midlife women suffer from generalized musculoskeletal pain, which affects all the muscle, joints, and bones simultaneously. It can be a pain due to SLE, fibromyalgia, maybe due to viral infection like flu, bacterial and parasitic infections like Lyme disease, malaria. It can be due to nutritional deficiencies like vitamin D deficiency or sometimes severe physical conditioning like too hot and too cold environment. So I want to discuss about fibromyalgia because we have discussed the vitamin D deficiency in many lectures, many previous lectures. Fibromyalgia is a chronic pain disorder. It is primarily characterized by widespread musculoskeletal pain, often accompanied by fatigue, cognitive dysfunction, sleep disturbances, and psychiatric symptoms like anxiety and depression. And it is the leading cause of generalized musculoskeletal pain in women. The major symptoms of fibromyalgia include there is problem with the vision, there may be chest pain, there may be muscular pain, pain in stomach, lower abdomen, There may be skin changes, joint swelling, and pain in the jaw. We have seen the prevalence of chronic pain, and it is around 36% of all the midlife women, and only 6.2% is caused by fibromyalgia, and rest of the pains are chronic pain which are not related to the fibromyalgia. So prevalence of fibromyalgia is around 2 to 3%, and the incidence increases with age. Highest incidence we see between 20 to 55 years of age, and it is twice more common in women than male. Risk increases with the pre-existing rheumatic diseases. There may be genetic predisposition for this pain. Obesity increases the pain, and physical inactivity is the one of the important cause. But experts did not find any single cause of fibromyalgia. But the key factor is there is disorder of pain regulation system, which is influenced by genetic, environmental, and neurological factors. And there is central sensitization and altered pain processing in the central nervous system. There are changes in the autonomic nervous system. It has been observed that there is reduced heart rate variability and changes in the skin conductance, and there is overactive stress response and dysregulation of hypothalamo pituitary ovarian axis. There are changes in the neurotransmitter levels. A functional MRI shows reduced activation in the ventral tegmental area in patients with fibromyalgia, suggesting altered dopaminergic and GABAergic neurotransmission. And there are changes in the central nervous system also. There is reduced gray matter, premature brain aging, and there is decrease in the cortical thickness as well as decreased brain volume. So we can easily compare the vitamin D deficiency with the fibromyalgia, because with the fibromyalgia there are changes in the central nervous system as well as in the autonomic nervous system. So what are the triggers for fibromyalgia? It may be a physical trauma, it may be an emotional stress, lifestyle factors, or it can be environmental factors. Diagnosis of fibromyalgia is mainly by exclusion of the causes, and it is diagnosed clinically. But no single blood test can diagnose that this is a case of fibromyalgia. It is diagnosed only by excluding the all causes of body ache and pain. And patient complains of widespread pain more than 3 months of duration associated with fatigue, exhaustion, unrefreshing sleep. There is difficulty in memory and concentration, headache, anxiety or depression, or irritable bowel syndrome. Diagnostic criteria include it is a guideline by ACR 2026. It is a revised guideline, and a patient can be diagnosed with fibromyalgia when there is widespread pain, VPI score more than 7, systemic severity scale of more than or equal to 5, or when the WPI score is 4 to 6 and SSS or systemic severity scale is more than 9, then we label it as fibromyalgia. And usually the pain is present in at least 4 to 5 of body regions, and the duration is, as I said, should be more than 3 months. Investigations include routine tests like CBC, ESR, thyroid profile, vitamin D, vitamin B12 levels, blood sugar levels, and rheumatological tests if required. So, we can differentiate the fibromyalgia with vitamin D deficiency. In fibromyalgia, there is widespread pain, fatigue, sleep disturbance, cognitive symptoms are present along with the pain, and the investigations are usually normal. But in cases of vitamin D deficiency, there is usually bone pain, muscle pain, joint pain, and we get low serum vitamin D levels, and symptoms get relieved after vitamin D supplementation. It may be possible that vitamin D deficiency may coexist with fibromyalgia, and low vitamin D levels may worsen the pain, fatigue, and quality of life in cases of fibromyalgia. So, vitamin D deficiency is not always present in all cases of fibromyalgia. It may coexist, but if it exists, it will worsen the problems of fibromyalgia patients. So, any widespread pain should be evaluated for vitamin D deficiency, thyroid profile, and other tests which may mimic the fibromyalgia. So, what are the red flags? Any case of body pain, if we consider it as fibromyalgia, but if we have red flag symptoms like fever, unexplained weight loss, joint swelling, muscle weakness, abnormal neurological finding, and raised CRP, then we should move for further testing. Management of fibromyalgia includes identifying and treating the fibromyalgia effectively, reducing the symptoms, minimizing the disability, and improving the quality of life. It should be treated like a multidisciplinary approach. We need to give medications, we need to advise exercise, sleep health is important, stress management therapies, and support is required. Patient education and reassurance is very important because fibromyalgia pain is really a chronic pain condition, and realistic goal is to control the symptoms only. We cannot get the complete cure of fibromyalgia. We need to encourage the regular activity and self management. Exercise is most effective long term management. Low impact aerobic exercises, walking, cycling, swimming, and we need to start slowly and increase gradually. Sleep optimization is very important. Maintain a regular sleep schedule, avoid caffeine late night, limit screen time, and treat the underlying sleep disorders. Psychological therapies like cognitive behavioral therapy, stress management, and relaxation exercises and mindfulness is also important for the management. Medications like amitriptyline, duloxetine, pregabalin is drug of choice, and carbapenem may be given in the selected patients. Opioids, NSAIDs should be avoided in cases of fibromyalgia, and improvement is usually gradual, and it will take weeks and months to get relief from the pain. Management of associated conditions like depression, anxiety, vitamin D deficiency, obesity, irritable bowel syndrome, and migraine is also very important. And take home message is effective treatment requires a multidisciplinary approach. Always confirm the diagnosis and exclude the other cause because it is the diagnosis of exclusion. Serious conditions must be excluded when red flag symptoms are present. Correct vitamin D deficiency, encourage physical activity, start graded exercises, maintain sleep hygiene, add medications if necessary, avoid sleep disturbances, and regular follow up is very important. So, together, let's raise the awareness of and promote the understanding and support every woman with fibromyalgia because it is an invisible illness, but the real strength is the endless courage. Thank you. Thank you very much for patient ear.
Thank you so much, ma'am. It was a very crisp yet very enlightening lecture. And as rightly been pointed by you, that this condition is now presented in mostly more than 50% of the menopausal women coming to our OPDs, and just the calcium supplementation and vitamin D doesn't suffice. एंड टिपिकल कंप्लेन यही रहता है कि सुबह उठते साथ ही पूरे हाथ पैर जोड़ों में दर्द रहता है, हिलते ही नहीं बनता है, मसल्स स्टिफ लगते हैं. So simple lifestyle management, as pointed out by you, and the yoga therapy would definitely give the dramatic results. Thank you.
For the next talk, I would like to invite Dr. Rekha Ratnani ma'am on the topic premature ovarian insufficiency, diagnosis and management. The chairpersons for the same are Dr. Sanjana Khemka, Dr. Shanti Pandey, Dr. Abha Daherwal ma'am, Dr. Ritu Shilp Varma, and Dr. Saurabh. Thank you.